So my dear students, welcome to my YouTube channel. This is the last lecture, lecture number 5 regarding UVR, physiological and therapeutic effects. From lecture number 1 to 4, we had seen therapeutic, what is electromagnetic spectrum, therapeutic production of ultraviolet radiations, which includes your mercury vapor lamps, in that air cooled lamps and water cooled lamps and fluorescent tubes. Then dosage calculation, what is minimal erythemal dosage and how to progress with the dosage. So from 1 to 4 lectures, we had seen all those in depth. This one is the lecture regarding what does UVR do to the system and how can we use in therapeutic purposes. So this is our last lecture, which would be for UVR. Physiological effects of UVR are basically divided into two parts: general effects and local effects. So here we would be seeing our general effects and local effects, including the therapeutic effects. So as I said, the physiological effects of UVR are practically divided into two parts. One is local and another is general. The effects which are produced locally in the area, yes, that are known as your local effects, and systematic effects after UVR therapy, they are known as general effects. Yes, so practically, if I want to term what are local effects, where the treatment is given. Yes. And apart from that, widespread irradiation is known as your general effects. Okay. So first thing we would see is erythema. Now erythema is nothing but redness of the skin. Clear? So erythema is nothing but reddening of the skin. Now why does this erythema occur? This erythema occurs basically because of triple response. Very important MCQ question and way of viva question. The UVR causes chemical action which results into irritation and destructions of cells, and those are your H substance, release of H substance. So in the next slide, what we are going to see is that these are the things which is known as triple response. It includes dilation of capillaries, dilation of arterioles, and exudation of fluids. Okay, so basically your redness of the skin after UVR treatment is because of triple response. This triple response includes dilation of capillaries, dilation of arterioles, and third one is exudation of fluids. So this is the reason these things are very much important. Okay. Now, if dilation of capillaries occurs because of your H substance, dilation arterioles is because of your axon reflex, and thus fluids is being exudated. It increases the permeability of capillary walls. So this figure shows this is nothing but redness. So these are generally, you can see it even in your sunburns. Apart from this, then we have dilation, redness of the skin or erythema is always followed by pigmentation. Why pigmentation? Because it stimulates the melanocytes. So once the melanocytes are stimulated, it accelerates the melanin pigmentation. So that is why there is increased melanin. Now, this melanin is responsible for darkness or pigmentation. So pigmentation is always followed by erythemal reaction. It again varies. What is the redness of the skin? The redness of the skin and pigmentations and all these local effects vary on the type and duration of UVR. So you can see in this diagram, in this figure, that immediate pigmentation darkening. Yes, so this is your basement membrane, basal cell level. So if this is your melanin site, melanin in the melanosome, single UVR is given, what happens? It increases, redistribution is formed. Yes, and why delayed tanning is that? Because melanocytes are increased and single UVR, it increases the keratinocyte, thus thickening the epidermis. Also, you can see the increased activity of the melanin. So see, melanocytes and keratinocytes, increased numbers of melanosomes. Clear? So pigmentation is generally because of pre-existing. Sometimes immediate tanning occurs because of pre-existing melanin. So if you are using sun alpine lamps, brown color, and like sun or carbon arc lamps, and vapor grayish color in the mercury vapor lamps. The pigmentation reduces the penetration of UVB. That's the physiological effect. Okay, now moving on towards thickening of epidermis. So first thing is erythema. Second thing is pigmentation or tanning. Third is thickening of epidermis. So thickening of epidermis is because of production of keratinocytes. This leads to the thickening of epidermis, which acts against the protection of the rays. So if this is your membrane layer, so continuously it will increase. So this means the layer has increased, so the depth of penetration of UVR is reduced. Yeah. So longer dosages are required to repeat an erythemal response. So once there is a thickening of epidermis, we need to increase the intensity or duration of your UVR. So that is why we always repeat the dosage once the erythemal reaction is subsided. After thickening of epidermis, we have casting off, that is peeling of dead cells. That is peeling of dead cells from the surface. That is known as desquamation, and it is directly proportional to the intensity of erythema. So more the intensity of erythema, more the desquamation. The peeling results in reduction or the loss of the increased resistance of the rays. So once there is a peeling is done, then again you can administer. And then the fifth effect is antibiotic effect over that area. That is nothing but destructive effects of ultraviolet increases destruction of viruses, bacteria, and small other organisms like fungi community in open wounds. Yes, that is generally the effect of UVB. So, what are the local effects? Local effects of UVR. First one, erythema. Second one is tanning. Third one is thickening of epidermis. Fourth one is peeling or inflammation. And fifth one is antibiotic effect. Basically, in the yeah. So these are your local effects of UVR. So moving ahead is general effects. Okay, so as we all know that sun is the natural source of UVR, and UVR has a role in vitamin D production. How? UVR, in the presence of UVB, 7D hydrocholesterol in vitamin D converts 7D hydrocholesterol into vitamin D, and vitamin D is required in the absorption of calcium and phosphorus. So if you don't have vitamin D, it may lead to you rickets. Clear? So this is very important. 7D hydrocholesterol is converted into vitamin D. Second effect is esophylectic effect. Yes, esophylectic effect is nothing but stimulation of your reticuloendothelial system. Thus, it produces antibodies against the bacteria and toxins. Yes, similar to your immune system. So if you give UVR radiations, and specifically UVA, it stimulates reticuloendothelial system and has antibodies production against bacteria and toxins. So the resistance of the body to the infection is released, and this is known as esophylectic effect. General tonic effect is the third one, which is the general effect. It is claimed that because of general UVR, what happens is it increases appetite, sleep is improved, decreases the nervousness and irritability. Okay. Yes. So now before we move on to the therapeutic effects, I will quickly revise the general effects. General effects of UVR. First one is vitamin D production. Second one is esophylectic effect. Third one is your general tonic. Yeah. So these are very important physiological effects. What are these? These two are physiological effects. What are these? Physiological effects of UVR. Okay. Yeah. Now moving on towards the therapeutic effects. The therapeutic effects. So where do we generally use? As I said, UVR is generally used in skin disorders. Okay. So the first thing when we talk about UVR, it is psoriasis, which comes into our picture. How does this affect in psoriasis? Basically, psoriasis is a skin condition characterized by thick, pink, red, silvery scales. Okay, flakes are there, so you can see these are the silvery structures, thick and pink, red. Okay, it is basically UVR irradiation is used to decrease the DNA synthesis into the cells of the skin and improve the skin condition. Very important practical viva question. Okay, why do we use UVR in psoriasis? Because to decrease the DNA synthesis and improve the skin condition. Clear? So how do we generally use UVR? So you can see the silvery scale structures. The difference between eczema and psoriasis is these silvery scales. Okay. So you can see you have epidermis and dermis layers in the normal skin. Okay, this is your epidermis, this is the dermis. What happens in psoriasis? The scales are formed. Okay, so there is premature aging of the skin. So there are basically three types of UVR treatment for psoriasis. First one is Gokerman regimen, second one is Leeds or Ingram regimens, and third one is PUA. This is a very important theory question and your practical question. In Bokerman regimen. What do we do? Coal tar application 2 to 3 times a day. What do we do? UVB radiation and suberythemal or even dosage is given. Okay, in lead Zephyr or Ingram regimen, coal tar is applied at the time of bath prior to the treatment. Then the psoriatic lesions are covered by diphenol cream, that is a steroid cream. Yes, general application through therapeutic tunnel and suberythemal even dosage is used. And in PUA, Soralin is given 2 hours before the exposure and UV radiation once in a day. Yes, so generally even dosage is given and max to max E2 dosage is given. So if you are giving even, this means you can give it almost daily. Okay, and if you are given E2, you can give it on alternate basis. So very important, coal tar application 2 to 3 times a day, suberythemal dosage. Here also suberythemal dosage, but inclusion of diphenol cream, and here Soralin is given. Second one is acne. Okay, acne is also a skin condition wherein it is characterized by papules, pustules, yes, comedones. So comedones are then converted into papules and then pustules. A skin condition with presence of pustules and papules formed by blocking of sebaceous pores. Okay, so these are the acne conditions generally seen on face and upper back. What is the dosage? E2 dosage is given to the face, chest, and neck. Why do we use? Because of desquamation. Desquamation is nothing but healing effect, to get the healing effect. Okay. Third one is eczema. The only difference between eczema and psoriasis is your silvery scales. It is again an inflammatory response. It is generally associated with edema, itching, redness, scaling, and vesicles. Okay. So subacute and chronic stages, mild UVR is given. Then we have open wounds, infected wounds and non-infected wounds. Okay, so ulcers, pressure sores, surgical incisions. Okay, what is the main aim? If it is an infected, it is to reduce the infection by destroying the surface bacteria, remove the sludge, and promote the repair, that is healing. Generally, E3 dosage is given, and if the infection is very severe, okay, you are giving E4 dosages. Clear? So you can see ulcer. Now in this ulcer, basically very interesting thing is, I would like to even draw the ulcer also over here. So consider if this is the ulcer. Okay, the ulcer has three components: floor of the ulcer, wall of the ulcer, and base or edge of the ulcer. Clear? So I would mark it over here with different colors. This one is floor. This one is wall, and the above one is the base or edge of the ulcer. Clear? So once you can see, ulcer is nothing but discontinuation in the epidermis of the skin. So this is your ulcer. So what are we supposed to do? Floor E4 dosage, wall E3 dosage, and base of the ulcer is nothing but E2 dosage. So generally you can identify the ulcers based on these parameters. If it is pale and anemic, it is indolent ulcer. Green and yellow, it is infected ulcer. Pink, purple with red spot, it is granulating ulcer. Wall of the ulcer, if it is well defined, yes, and straight, it is spreading ulcer. Hard and edematous, it is chronic ulcer. And shallow and sloping, it is your healing ulcer. And if the base is hard, it is severe ulcer. So practically you are supposed to find out the depth of the ulcer also using a measure tape. So that comes under your measure assessment part. So these are your pressure areas. Okay, occiput, ears, your scapular levels, your elbow, your heels, yes, ankle levels, groins, hip, yes. So these are your pressure areas, gluteal regions, knee, and different positions. Another condition is your vitiligo. It is a condition wherein the destruction of melanocytes occurs. Yes. So practically, if you see, when we had discussed about psoriasis, acne, and eczema, what was our purpose? Our purpose was to reduce, yes, the skin condition. Yes, in even in the wound, we were wanted to reduce the infection, whereas in vitiligo, we want to increase the melanin pigmentation. Yes, so that means we need a larger UV or long lasting, yes, effects of UVR. So UVA is used and UVB provokes more thickening. So for increasing the melanocytes, yes, so you need a high intensity or longer duration of dosages for vitiligo. So this is your vitiligo. And then if you have non-infected wound, generally for growth purposes, we use UVA. Yes, and the examples are venous ulcers and arterial ulcers. Clear? The counter irritation. Yes, counter irritation is nothing but for deep-seated pain. We generally give E4 dosage. We generally give E4 dosage of pain, dosage of UVR to get discomfort and produce mask of pain. Yes, so that is the reason the original pain cannot be felt. Clear? So dermatological conditions, calcium phosphorus diseases, non-pulmonary tuberculosis, local ulcerations, and counter irritation effects are general indications of UVR. Contraindications: pulmonary tuberculosis, systemic lupus erythematosus, cardiac disturbances, photosensitivity, photosensing medicines, deep X-rays, and acute febrile illness, and recent skin grafts are contraindications. So, what are the therapeutic effects? Therapeutic effects of UVR is nothing but psoriasis, acne, eczema, vitiligo, wound that can be open and also infected. The open wounds, and definitely infected or non infected. Yeah. So these are the basic 5 things which we need to understand about therapeutic effects of UVR. In psoriasis, we have Bokerman regimen, Ingram regimens, and PUA therapy. PUA therapy is generally given by therapeutic tunnel, and generally we are giving suberythemal dosages or even dosages. Even in psoriasis and eczema, acne, we may give E2 doses because we want desquamation and healing effects. In vitiligo, we may go for E2 or E3 doses because we want to increase the production of melanin and wound effects. Clear? So this ends our UVR lecture series. Next lecture series in my YouTube channel will be based on laser productions. Till then, if you have any doubts, please let me know. I'm very bad at drawing, so please bear with my diagrams. Okay. Thank you very much. Thank you, my dear students.